everyone, this is Shadi Reyes. This is SIF 2021. With me is Dr. Nadia Sutton. She is Assistant Professor of Medicine at University of Michigan. Nadia, welcome to the show. This is SIF 2020 was virtual. Now we are back in live meeting. And give us some of your experience about the meeting so far.
All right, well, thank you so much. I'm happy to be here. Thank you for having me. So I am super excited to be at SIF this year. This is the first in-person meeting that I've attended in over a year.
Yeah.
It's the first plane trip that I've taken in over a year. I'm very glad that the pilots weren't rusty.
Yeah.
So no, it's great. I mean, we have live speakers. I'm learning a lot from the co-panelists and other moderators and their presentations. Learned a lot, even myself, in terms of preparing my presentation. So I think it's just a great incentive to get out there and meet people and network.
And the safety that and the health, that social distancing, checking the temperature, having like a checklist before coming to the conference, I think it was unique, and you have to adjust to this new procedure going forward.
No, absolutely. I mean, I think a fair number of the attendees most likely have been vaccinated, because most of us are in the healthcare field. And in addition to that, the conference has really gone above and beyond in terms of masking and social distancing and generally making sure that the attendees, as well as the faculty members and the staff that are essentially putting on the conference, are safe.
So today was a full coronary day, and yesterday was structural. You moderated multiple sessions. You presented about MINOCA, INOCA, and others. But every talk, somebody always comment about the change in practice during COVID. So what is your current cath lab procedure and protocol for COVID?
That's a great question. I definitely have taken care of COVID positive patients in the cath lab, some of them in the setting of shock, some of them who had ACS in the setting of COVID. But generally, we are still taking full precautions, wearing N95s when we have a COVID positive patient. I think that that's really important, especially because you don't really know who amongst your staff has been vaccinated or not vaccinated. And with potentially, I suppose, varying strains, I think it's probably good to still take precautions. But our practices have not necessarily changed as of yet, but I think that will have to be reevaluated over time. I mean, fortunately, we have seen diminishing numbers of COVID patients in Michigan. So that's good, and I think we've also learned a little bit better how to treat them and support them through their illness, which is good. But certainly until we have a greater proportion of the population that's been vaccinated.
So your message there is we are vaccinated, we have precautions, but we shouldn't lower our guards yet, because especially we're the first liner, so the precaution should be there. Patients should be tested before coming to the lab for elective procedures. Let's move gears to today. I was very impressed with one of the talks with Dr. Tim Henry about the complete revasc, and I was kind of interested to see that the guideline in the US take too long to get changed, although we have change in evidence in complete revasc. This is one of the things. What do you think the problem for not getting the guideline updated timely?
No, I think that that's a really great point. I mean, our STEMI guidelines are, quite old at this point, frankly. It doesn't reflect a lot of the changes in our medications that we use and all those kinds of things. So I definitely think that the STEMI guidelines are due for an update. I would have to check with AHA, ACC to see where that is in process. I know there is a plan for guideline updating of, for example, chronic coronary artery disease. So I know that there are some things that are in progress and planned. But I agree, STEMI guidelines especially are overdue for
And that's put the pressure on us as a practitioner, is if we do something that is evidence-based, but yet not in the guidelines. So I'm not trying to say we're doing defensive medicine, but we are kind of under pressure between doing it versus not, because the guideline does not recommend it yet.
Right, no, I totally agree. And I think that that's what makes conferences like SIF that much more relevant and important, because ultimately you can hear from the leaders in the field as to what they think that the practices should be. And I think that hearing that from the experts does give you some ammunition in terms of your approach to patients and being able to defend your decisions.
Make you more comfortable, at least, if the leaders in the field doing it, so that's a good reason to do it.
Absolutely.
Nadia, thank you so much for being with us. Please watch this video and others on SIF YouTube channel. This is Shadi Reyes from SIF 2021. Nadia, thank you.
All right, thank you.